Hello, this is Dr. Manasi Kulkarni-Khasnis and we are in conversation with Dr. Satyajit Pawar. So in the last discussion we discussed about what is lung cancer, what are its current detection methods, and we stumbled upon a word, very key word called high risk individuals, and I wanted to ask him, what are high risk individuals?
So high risk individuals means that individuals who are at high risk of developing lung cancer in their lifetime. Currently, how we define high risk individuals is that those who are smokers, current smokers or past smokers with prior history of more than 30 are labeled as high risk individuals.
Okay.
And these individuals become eligible for screening methods.
Okay. So what is screening? Screening is basically looking at the population who do not have symptoms and look for cancer signs of cancer. So screening is a technique in which population is looked at from an angle of cancer signs, and is only high risk individuals are allowed to take part in trials. It is what we see. So are there any trials that are going on in the globe?
So we have data from two large concluded randomized trials. Those are Nelson and NSLT. Basically, those trials, what they did, they chose high risk individuals who are, like I said previously, those who are current smokers or past smokers with significant smoking history. They were included periodically to undergo low dose CT scan.
Okay.
So what we mean by low dose CT scans are, these are basically the radiation, amount of radiation given in those low dose CT scans, so almost 1/8 of normal chest CT.
Okay.
So that you don't get exposed to more radiation in your lifetime.
Okay.
In those trials, basically they did a periodic screening at, let's say, at one time point, and then followed by periodically yearly for 3 years to up to 5 years.
Okay.
And these individuals are monitored for development of new lung nodules or any radiological signs of lung cancer.
Okay.
With low dose CT scan, they found that around 40% of patients were more able to detect at stage 1 as compared to not doing any screening.
Okay.
And they found that with doing low dose CT, they were able to prevent mortality in almost 20% of cases more.
That's huge.
Yeah.
That's huge. So low dose CT scan. So in both the trials, the data is comparable.
Yes. So almost 18 to 20% of increased survival rate were found with doing low dose CT scans.
Okay. Okay. So low dose CT scan is globally accepted gold standard right now for lung cancer screening. What are the promises for other newer technologies that you see? Looking at the limitations that we discussed in our last conversations of low dose CT scan, what can be the avenue for newer ones?
Yes. So as I told you previously, in low dose CT scans, there are some false positivities, and one of the important drawback for low dose CT scans is the high risk population defined is only for smokers. What about non-smokers? As we see in our Indian population, most of the individuals which we see, most of the patients of lung cancer which we see, almost 20 to 30% are high risk as defined by previous trial criteria. So most of them are not high risk individuals, and what do we do for them? So there are certain newer methods coming up, like blood-based screening or a liquid biopsy based screening, which can detect lung cancer earlier or any other cancer earlier as compared to doing a radiological screening.
And what role can a multi-omics approach, like proteomics, metabolomics, what are your opinions or thoughts about it?
So the disadvantage of liquid biopsy is that it is not sensitive enough, or for it. Like I said, currently US government has approved liquid biopsy as a screening method for colon cancer. So if we see previously colon cancers were screened by colonoscopies periodically. Now they are trying to move to blood-based screening. Similarly, if we look at lung cancer also, if we move to blood-based screening, we need to have a test which is sensitive enough to detect early stage. If we are detecting it late, then there is no point in blood-based screening. So doing a biomarker based, like multi-omics based approach will help in increasing its sensitivity.
So multi-pronged approach is being now adopted by certain companies or certain labs, and they are experimenting on such approaches. What happens is that in doing or increasing the sensitivity of the test, people go towards machine learning methods or artificial intelligence, and in utilizing the power of technology, computer technology, in biology or biotechnology to increase the power of the test.
Yes.
What are your thoughts about it?
So currently people are doing as a massive parallel sequencing. They are using AI-based AI-based analysis of that data to get more information out of it. Similarly, people are using AI for analyzing radiographs and then differentiating between non-cancerous or benign causes versus malignant causes.
Correct.
So AI will be able to monitor, or I would say, it will not miss any change as compared to human eye.
Right.
So it will be more sensitive, I would say.
Perfect. Now I wanted to come to a very important question for our listeners, that cancer is not a notifiable disease in India, in all the states, is what we know. And what are your thoughts about it?
So what I would say, there is still stigma attached around cancer world. Currently we have 3 major cancer screening programs: breast cancer, colon cancer and cervical cancer. In India there is screening program for oral cavity cancer also. But still we do not see uptake of this. I would say less than 10%. Only in I should say metros, we are currently seeing that people are undergoing regular screening for mammography at least. But still we see stage 3, stage 4 diseases in young individuals or people who are from well-to-do background.
Right.
So if we need to remove that stigma of world cancer, because finally cancer is curable and it's not a death sentence. If we detect it early, we treat it properly, it is curable.
That's a golden statement that we are hearing, that cancer is curable if we detect it early. It's like looking at that small leak in the kitchen, and if you do not administer a change or manage that leak properly or within time, you are going to flood your entire kitchen and the entire house as well. So it's up to us when to act on it, when to detect it, and when to be aware. And this is your chance to get aware of lung cancer with our series Varsi Lung Empower Drive. Signing off, Manasi Khasnis.